when the pandemic hit here in Spain, I get stuck in home as a lot of people because of lockdown. And my glucose started to go wild. In a couple of weeks, I lost control of my diabetes and I couldn't talk with a doctor. And what I felt is like I was alone with my diabetes for the first time in a lot of years. And then what I saw is that I have a lot of data, I have an interest in programming, and I have diabetes. So that's where Cori was born. And then we started like a really, really fun and really charm experience building this enterprise.
Are you an entrepreneur looking to disrupt the healthcare industry? Do you want to stay on top of the latest innovations and trends in the world of health and wellness? My name is Gonzalo, and I welcome you to this brand new podcast titled Healthcare Disruptors, that explores the intersection of entrepreneurship and healthcare. In this series, we will be talking with entrepreneurs, experts, and CEOs who are revolutionizing the healthcare sector through cutting-edge technologies, products, digital services, and much more. Healthcare Disruptors is brought to you by the EIT Health Innovators community, a network of professionals who are passionate about revolutionizing the healthcare industry. Join the community today. Today we have Asier, the founder of Cori Diabetes, and he considered itself what I'm going to read based on his LinkedIn. The sentence is, I was going to be an archaeologist, but changed my mind when I found out it wasn't as exciting as Indiana Jones. I do cool stuff on 2B apps. So this is amazing how the way we're starting. And he's running Cori Diabetes, that it is an artificial intelligence driven health coach app that seeks to revolutionize diabetes management software with an AI-driven approach. But Asier, thanks for coming, and this is your place.
Yeah, thank you, Gonzalo. It's been a while since we talked back, so it's a pleasure to hear you and see you again.
Okay, thank you. So first of all, I would like to introduce yourself to the audience and also your company, because it's really funny what you have in LinkedIn as your intro.
Yeah.
But tell the audience who you are, what you do, because I know that you are in the technology and healthcare world, and all your story in order to catch up a little bit with the audience.
Yeah, I'm a really different type of profile for an entrepreneur because for being in the health sector and especially in the tech part, where I'm the lead developer of a team of 4. So my background is not at all in engineering or computer science. I studied journalism, which is like contrary to technology. Sometimes journalists are really afraid about technology because it's always disrupting their business model. So that's something that I think that makes me like think out of the box for some technologies and some solutions for the healthcare and also in the tech world. But I think that the most important thing of me is that when I was 14, I was diagnosed with diabetes just 2 days before Christmas. And I started running a marathon I wasn't prepared for. And, being diagnosed with a chronic disease, especially so young, is like really, really hard because when you're 14, you feel invincible. You're not going to die ever. You're going to survive and you're going to live and laugh and have a lot of fun. So being to grown up so quickly and start to being able to need to take care of yourself really changes your experience as a person. So that's why we started building Cori, because when the pandemic hit here in Spain, I get stuck in home as a lot of people because of lockdown. And my glucose started to go wild. In a couple of weeks, I lost control of my diabetes and I couldn't talk with a doctor. And what I felt is like I was alone with my diabetes for the first time in a lot of years. And then what I saw is that I have a lot of data, I have an interest in programming, and I have diabetes. So that's where Cori was born. And then we started like a really, really fun and really charm experience building this enterprise.
Yeah, to be honest, I mean, to me, you are a real disruptor, and you are inside the healthcare, because the thing is that even you don't have this technological background, you have more a communication background. You make all the relative to the technology, and you know how to manage the technology in order to keep on track your disease that is diabetes. So to me, is you are the total disruptor in everything, in what you do and in how you are. And what is the meaning for you of being a disruptor?
I think that when you don't really know all the rules, it's easy to break them. That's what happens with the kids. Kids don't know the rules, and kids can imagine and can do everything. And then as we start to grow older, we start to really know the rules of the society, of the tech, of the technology, of the enterprises. And then the imaginations start to slow down, and you need to really think again as a kid and start to breaking rules and think with another point of view. When you see technology from the point of communication, what you see is that people are not understanding technology a lot of the times. When you see healthcare as from the point of a patient instead of a doctor, you need to design the tools completely differently. What we saw on the market with diabetes is that there was a lot of apps, but most of them were the same, like they were for doctors, with really complex designs, really complex meaning. And if you were on the patient's shoes, you will see that, you don't have time to check your glucose and start to analyzing it all the time and seeing it. So you need to take that other perspective on mind. And that's why I think we are considered as disruptors, but I think that we can disrupt more. So.
I love it. I love your message and your answer, and I would love to see you yourself and your company bringing more disruption to the diabetes management. And you mentioned two interesting things when you are launching a healthcare app or product, in order to break in the rules. That one of them is that you wear the shoes of the patient, so you know what you need, and that this is really important. And you put it together with the design. My next question is gonna be like for that way, and at the same time I love what you said about the children, and that when you are a children, you don't know the rules, so you are breaking them because you don't know that they exist. So it could be based on your profile that it came from the communication that you are breaking the rules. And regarding the design, it was one of the questions I had, is how important is the design in to engage your users? Because the thing is that I've seen Cori and the evolution since you started, and the design all the time is one of the peaks that you have. So how do you think that it is important in order to engage the users?
I think that design is something that people don't care about until it's or really, really good or really, really bad. For example, when you start a business and you say, my key differentiator is going to be that, or design is going to be 10x better. People say, people don't care about design. And after seeing our work in design, people say, you're really, really good because design is different and design is good. So it's like sometimes, especially I think in Europe, we don't value design as much as we should. And it's something that lacks us, it's something we lack as a society. But I think that it's really, when you design something, is really, empathy is really important. You need to be in the context of the user. Is sometimes we tend to overwork like user personas or user flows, but it's very important because when you think about someone with diabetes that needs to check how they are before they are going to eat something, what they need to do is like be really quick, be really easy to understand, because they are not taking all their attention to the app. They are taking with someone, they are cooking, they want to start a movie. They are not giving the full attention to the app. So if you overcomplicate the design, if you are not really clear, if you're not direct to the information, the app is not going to behave well. So for example, what we do is like we color tint all the information. So for example, if you are like on target, you are going to be green. If you are a little higher, the app tends to go yellow and then red. But not only the colors change. For example, Cori, which is like an anime, it's like a puppet, changes his face to be sadder or happier if you are good or bad, because sometimes you don't have like, you need to take context of the number by other meanings. So you don't need like to really read the number to see if you are doing okay or not. And then other thing is like how we present information. For example, sometimes we overestimate to use charts or maybe numbers to present health information. The numbers are important. Don't understand me. Don't understand me wrong. But you can bring other meaning to the number to give more information. For example, right now we are working on a forest. It's like a conceptual forest. It's not a real forest. And what we want to do is like, you understand if a forest is doing okay or not, because the trees are green and there is a lot of water or animals. But if it starts to get like a desert, you know, it's bad. So you can bring a lot of information about someone, like taking it to a concept or a more conceptual representation of the data. And that's like why we are bringing outside the box to the app and to the healthcare system. So it's like you can design things to be like from really complex to really simple and to things that people can understand just by looking at it, not by understanding the meaning behind the number.
Yes, it's a little bit what you said in the beginning, that kids are breaking the rules because they don't know the rules. So at the end, kids break the rules when they play a game, and your app is like a game, as you told us. So it's something similar, and it's a metaphor of what you do. And going back to the design, because you even have been selected and have been featured by Apple. You've been in a program with Apple, Pfizer. You've been in different acceleration programs. So, what would you consider your biggest help so far in the way of Cori until now?
My biggest hit?
Help. What your biggest help?
Biggest help. Yeah.
Acceleration program.
Yeah.
Being together with Apple, winning a hackathon. I don't know.
I think that one thing that I heard when we started with being entrepreneurs is that if you want to be quick, you can go alone. But if you want to go really, really far, you need to get along with other people and work together. For example, Pfizer's help at the very beginning was incredible because we only have an idea and the app was only for me. They helped us a lot, but really, really a lot, to make it a company, to think as a health company, and also to start to think about other types of people with diabetes, other type of illness. And that was really important at that point. Right now, we have like a MVP in the market, and being able to start getting some traction, to really refine the product, to really polish the design, it's incredibly useful. And that's the things that Apple is helping us a lot, like how to acquire new users, how to improve our paywalls, how to manage a subscription for an app, how to do like really good design. That's the key thing for us right now. maybe in a couple of months we will need another thing, and we'll need like the help of the companies or other people. But the part is that it's like your from your children, you cannot tell which one you love more, because they are the same. And for us, the help we have received from both Pfizer and Apple has been like really, really incredible. And also another thing that is really, really helpful for us is that here in the Basque Country, at least, we have a lot of help from the public sector, both the city county, Bicaraba, which is from Grupo Esprit, and they make us possible to make the enterprise, thanks especially sometimes by European funds. That's something that people tend to forget, that money sometimes is and some funds and help is also comes from the European Union. So that's also important. And in the end, you live in an ecosystem. So it's not like one thing is better than another. It's like the help of all the things, of all the parts make us make things better. You are muted.
Yeah. Good, Asier. So the thing is that one of my questions was going to be how easy or difficult it is to land a new business from the Basque Country to the world, but you already told us that it's really easy. They are helping you in order to get fund. So to be honest, it's what all of us expect from public administrators. So really happy to hear that.
Yeah.
So, and I think that I'm going to jump to, because you told us that your biggest help has been being together with Apple and Pfizer for this one.
Yeah.
But in your way so far, what was the biggest mistake that you have made with company? Because at the end, it's a learning curve that you know how to make things, but sometimes you get mistakes. So what would you say to there if that is?
I think that mistakes are going to happen. So it's impossible to not make any mistakes, especially when it's you're doing something new. You are going to have mistakes. For example, at the very beginning, we thought that type 1 diabetes was going to be like our biggest market. But then what we saw is like, type 1 diabetes is only 5% of the market. So we really need to rethink and pivot our product to meet the needs of the market and to really have a business, because otherwise it was going to be like really, really small. And in the end, I think that the biggest error you can make is like not being open to change. You need to focus, you need to have like your roadmap, but you need to also have the ability to change at time, because if you're really, really centered on your roadmap and your roadmap is not going to work, if you don't change it, that's going to be like the really biggest mistake. And also you need to have like a really good partnerships around you. You need to take like good contractors. You need to have confidence in them, and because otherwise, if you don't have confidence, it's not going to work. So that's like confidence and being able to change.
Good to hear that. And regarding that, I mean, I have like two questions at the same time. The first of all is that I want to know if is Cori diabetes sustainable nowadays, and what are the next steps in your roadmap, or what are your next challenges? I don't know. Tell the audience where you are and what you want to achieve.
We've been like playing around a lot with the product this past year, and we are finally on track to make our first version of the product. And I think that seeing the first couple of months of the year, we are on track to have like a good traction and to be on being a sustainable business. But as you know, Gonzalo, building a tech product, especially a software product, has a long way until they are profitable. So that's why it's important to also have like other sources of income, or we are a bootstrap company, so we need like other sources of income. But if you're not bootstrap, you really need the funding to get through the line. And that's like the hardest part of running a health tech business, is that it's not as quick and as easy to build a diabetes app and as a photography app, or maybe some filters for Instagram. And not that that's easy, but that can be done quicker, because in the health sector, you might need like some regulations and some, some certifications to make that the product works, because you cannot say like, yeah, my app is 10x better than the other apps. You need to prove it in the health sector. So that's sometimes it makes it like longer times to development and longer times to the market.
And what is the ways you are doing in order to try your app Cori Diabetes like a medical tool, and in order to validate it from the ecosystem point of view?
What we are doing right now is like we have the app in different parts, maybe like Lego blocks. So there are some parts that are public right now and that anyone can use, but there are other parts that are still in development, and even though that they are almost finished, we are still waiting for that certification. So the way we are working is like we have like this small block of, maybe some medication tool or something like that we are starting to get certified. And yeah, we're working, planning to do some types of clinical studies here in the Basque Country, but yeah, that takes a long time.
Yeah, and also that you, if I understood you well, you told us that you are trying to be bootstrapped, and at the same time you are going to launch or to get the information for clinical studies, and this is one of the things that are more expensive. So how do you find the balance between being bootstrapped and having this medical validation that costs money?
Sometimes it's all about funds on grants by maybe the European Union or maybe local public agents. And also we are trying to do a public investment round of funding. We are looking for funding because I think that you need to really find the balance between public funding and private funding, because otherwise you might get like accustomed to not needing to be profitable or not needing to grow or not needing to, because sometimes public funding is more towards about investigation, and that's really good, but you also need to find a business in what you're doing, because otherwise it's only going to be a paper. So trying to find the balance between public and private funding, I think it's the best approach. And yeah, it's hard. It's not easy. That's why not a lot of people are doing it.
Yeah, and also because, you came from the communication world, so how does Cori make this business mind? Because you are also in the technical part, so are you able to manage all the pieces of the puzzle, technical and also business, in order to find this way to get money and maybe in a future Cori sustainable?
That was one of the first things we have in mind. We have like the product thinking and the product design, and that was like one of the first steps. And the second one was the business part, because it's not my first rodeo here in the entrepreneur world. And the other past attempts failed because the business part was like really, really weak. So that's it's like on Zelda. Legend of Zelda, you have like the three forces, and here is the same. You have the product, you have the business, and you have the marketing. You need the three of them to make a successful company. The marketing part is obviously covered because I come from the communication world, and I think that we can do it better, but we tend to do it like really, really well, the communication part. The product part was the biggest challenge, because it's not easy to make a digital product in the health sector. And the business part is like the thing that it has keep us awake for more nights, because you need to make like a lot of numbers, you need to make a lot of predictions, and that's the part where we ask for help. You as an entrepreneur need to know when to ask for help, as I said earlier, and this part is one of them.
Yeah, I see. I mean, you are giving many insights, many tips to people who want to run a healthcare company or who want to go from idea to a company.
Yeah,
that, and we are going to jump a little bit to the technology side, because I've seen that you have interconnection with many glucose monitor tools. How is it? How easy or difficult is it? Or how important do you think in this specific area of diabetes management?
It's been hard to get all the integrations done, because sometimes these companies are really, really big, and the approval process is really, really long, obviously, because they need to take care that the decisions are aligned with what they want to do. So, for example, partnering with the ESCOM has been like almost a year of work, because we didn't only need to have passed some checks on the technology or that the integration work well, but also on privacy, because in the health part, the privacy and the respect for the data is like key. And at the same time, I think that as companies in the health sector, we need to really start to bring open data. Not that we publicly share all the data of the users on the web, but that one user can choose where to bring their data. So, for example, you have my medical data in one company. Why I can easily bring them or automatically bring them to other app they want to use. So that's something that we need to really work on, because I think that's going to drive a lot of innovation.
Yeah, I mean, this is what you are talking about. It's building the products with privacy by design. And the thing that now it's almost that you started alone, and now the company are growing, and there are some people who are joining your company. So how do you make this information open or transversal to all the people of the company in order to make things private by design?
I think that the data is private by design, because we don't have a way to identify which users data it is. So we don't know if this data is from someone or someone else. But also we don't see it. So we don't have like a dashboard where we can say, Frank from Belgium is having a good day because he's following his diabetes advice. So that's something we do. The other part is like, we don't sell data. If you have that in mind in your business model, if you don't depend on selling this data to other third parties, you can be sure that data is going to remain safe. Because as a business, if you really need to have other sources of income, if the business alone of the app is not enough to maintain the product, you will need to have like some difficult choices on the road. We don't sell the data. We don't use the data for someone else. And what we might open in the future is some clinical programs if people want to clinical studies. So if people really accept the terms and want to join and share the data for our clinical studies, they can do it. But we are not going to use it with our permission, or we are not going to share it. And I think that's really important for any health company, that you can really say it aloud and not be afraid that maybe in the future these words will appear as Joe Lion. So I think it's important to be honest with this.
Good. And regarding that, I mean, how do you communicate this private by design inside your company and outside your company? You mean in the app or in your webpage or whatever, in order to let the patients that their information is gonna be secure, and at the same time that people who work in your company is not it's not making a mistake because you are sharing some public some data to the public that should be private.
Yeah, that's the work. So it's not easy. For example, identifiers. You need to make them randomly. You need to change them, and it makes hard, for example, to get data when some identifiers are randomly generated, and you might know, you're also a developer. So that's part of the design of the platform. You also need to have like a really good backend and servers that you can trust. You cannot. So, for example, something we will never do is like put our own server, because we are a small company and we don't have the resources to build a private, secure, fast sync service. So that's something you need to have a partners that to work with. We have changed our backend recently. It's been like a really, really hard work of almost 2 months of working and changing all the parts of the app. But we really have like an end-to-end encrypted service now, and that we can also grow on and have this platform built in. So that's the work we do now.
Yeah, I know what you mean, and the thing is that there are many aspects that you have to take into account that we cannot go deeper in all of them. For instance, I mean, you also use the artificial intelligence, the AI.
Yeah.
So, I mean, because this is like a way that every product almost in the healthcare system. I was telling that I'm going to repeat the question. So we came from the privacy design, and we go to the AI, the artificial intelligence. That most of the products overall in the healthcare should work or should have a little or a big part of AI. So the thing is that how do you use it in your product, in your company, and what's the value that the AI gives to you and also to the users?
So in Cori, what the AI part does is like, as a user with diabetes, when you have like a smartwatch, and also like a continuous glucose meter, you might have like 200,000 data points each year for each patient. So it's like a really big data for one person each year. And the point is that we have all this data, but we only use it at the moment. Someone with diabetes might use the TGM, the continuous glucose monitor data, to see how is their trend and how they are right now. But what about the past? So I think that in the health sector, we can learn a lot about the past of the patient, especially if we have all the context needed. So for example, in Cori, we have like the glucose as the lifeline for the patient. And then we bring more context, for example, from diet, exercise, medication, physical status. And with all of that, what we can do is like see the future. So for example, what we do is like, if we predict that you're going to have an hypoglycemia in the coming hours, we might not even suggest you to do a workout. But if we predict that you're going to be like a little higher, but if you do some type of workout, your glucose is going to be better, the app is going to suggest you to do some type of, maybe walk the dog or run 5 minutes or 10. So it's not like we are doing AI to bring more complexity to the user. It's like we are using AI to bring like some coaching to the user. That's why we talk about a health coach, is that Cori really knows you well and sees how you are doing to tell you what to do next. And this is really, really different from what currently is in diabetes care. Is like they give you these types of paper that you to put on the fridge, and they are like, yeah, you need to do this type of exercise, eat this or eat that. But this is static. It's the same for every patient. It's the same for every day. But you are not the same every day. It's not the same for someone with diabetes if you wake up and you're going to take a run, or if you wake up or are going to go to the office. And the app should know that. And or IA models, what they do is like you see what you're going to do and then adapt the plan for you. Then one thing that's really different from our approach to artificial intelligence is that we have a generalistic model that we put in each version of the app. And then after 14 days of data collected from the user, this model is personalized by inference to that user. And this is really important to avoid bias because, for example, women during the period, some of them might have like higher glucose levels, others might have lower glucose levels, and others they not change at all. And if you do the average, what the model is going to say, it doesn't change at all. But it's not the same if you are on the top part or the bottom part. So that's where the bias come from. So once the model is trained with your data, you can say if you tend to go higher, the app is going to really know it. So that's one thing that's different in Cori.
Good. And one of the things is like you talk about that you understand the past of the patient, you work with the present, with the data of the patient nowadays, and you also want to keep being the coach of them in the future. And talking about the future, how do you see yourself and your company in 2030, for instance?
Wow, that's really hard to predict because if you told me 2 years ago that we were going to be in Pfizer's Innovation Lab or in Apple's Entrepreneur Camp, I will tell you, that's impossible. So I cannot predict where we're going to be in 2030. But I think that our goal is to have a health coach. Maybe it's an app, maybe it's a digital assistant. We don't know what form it should take because technology changes all the time. Maybe we are with reality, mixed reality glasses or something like that. So that's one part I know I'm not going to predict. But what I really see is like someone or some entity that you can trust and then is going to help you every day so you can keep going, because living with diabetes is like running a marathon you're not prepared for. You need to keep going because otherwise bad things are going to happen. So that's the thing we want to build.
Good. And at the end, a marathon is 42 kilometers. So we translate it to life. At the end is all your life. So the best for it. And one more personal question, because we are reaching almost the end. It's like, if there is any, what are the differences between you, Asier, as a normal person, regular person, as you? I mean, it is outside of the company, and you as a CEO or I'm co-founder, I'm founder of Cori. What are the biggest difference, or what are the difference between these two people, if there is any?
I think I am the wrong person to tell. I think that we should ask Patricia or someone else because they see me in both contexts. But I think that being from the south of Europe, we tend to be more impulsive, more with more hot blood, maybe more impulsive, more, also from Spain. So I think that when you are a business person, you cannot be driven by feelings. You need to be a more analytical person. And that's something that I have to learn because sometimes I'm more passionate than I should be. And that being passionate is like riding a roller coaster when you are an entrepreneur. So it's really good, really bad, really good, really bad. And you need to keep like a straight line and be more focused. So being more analytical, being more less passionate, if you say it, that's the big difference between the personal Asier and the professional Asier, if you say it.
Good one. And also, I mean, in order to wrap it up in the interview, I mean, just to give some takeaways to the audience. I mean, because you have your communication background, you wanted to be an archaeologist, and finally you are a healthcare disruptor and you are running a healthcare company. So tell the audience the things that you would like to tell to yourself when you was younger.
Sorry, I didn't. So to explain me, can you repeat the question, Gonzalo, please?
What would you tell to yourself when you was younger with the knowledge you have nowadays in order to let him grow or let him be happy?
I think that at least here in Vitoria, in my context when I was younger, I was really afraid to study technology. I wanted to become an engineer because I really love technology, and I was afraid to do that. And I think that's one of the biggest problems we have right now is that people are afraid about technology, are afraid about engineering, and that's something we are lacking as a society when we are teaching children to grow. We need children that can imagine to build anything, to dream and to not be afraid about failing, because failing is part of the life. On the other part, I think that sometimes we tend to think a lot about, what we could have changed 10 years past to make today better. But we don't ask ourselves what we can change right now to become better persons or a better society in 10 years in the future. So I think that the change I did 2 years ago when we started doing Cori is one of them, and I hope that when passing 10 years, I can be in the place where I would love to be right now. I don't know if that makes any type of sense.
Yeah, it makes sense. I mean, if it makes sense to you, it's enough. It's also related with our last question. That would be that what would be your advice for a person who wants to be a disruptor that makes the connection with what you answered to the previous question?
I think that it's you really need to think outside the box. Again, as we said at the beginning of the conversation, think about a kid. Start questioning everything. Why it should work as it is? Why it should feel as it is? Why it should be as it is? And when you start asking these questions, when you start really trying to break the mold and think outside the box, you can be a disruptor. You can be a disruptor doing really, really small things. For example, for our company, the biggest disruption we did is put people in the front of the center in the design, in the business model, in the company, in the marketing. And it's one really simple decision to make people front and center. And then it comes after that. When people is front and center, you care about their legacy. When people is front and center, you care about giving them a good experience. When you are at front and center, you care about doing the right things for them. And if you put other things in the front and center, you can do a really disruptive thing that's different and also better. Because if you put like maybe the planet in the front and center, or maybe the cost at front and center, you can take different decisions. So you need to really think a lot about what's the current status, what's the current the way things work, and why it works right as it is, and why it shouldn't work as it is.
I love it. So, and yes, I mean, I wanted to say thank you very much for being so open and to accept the invitation to be part of this healthcare disruptors podcast by the Health Innovators community. So now this is an open space for you to tell the audience whatever or what you are looking for, or if we haven't talked about any topic you want to share. So this is your time, Asier. So thank you very much. Now this is an open space for you.
Yeah, what I will tell is like, as I said earlier, Cori is a health coach for people with diabetes, driven by artificial intelligence. So they don't give up on the marathon that's linked with diabetes. And as we are in an innovators community, I think that a lot of disruptors might see and hear this. What I will call is like, if you want to make like diabetes better, or people with diabetes to live a better life, please contact me. I'm open to talk on, to discuss anything. So we can bring forces together and maybe have a bigger impact. So
cool. And how do they find you?
They can find me in LinkedIn. I'm Asier Morato on LinkedIn, and yeah, you can find Cori, and if you search Cori diabetes in Google, it should appear on the first results. So yeah, contact us, and I'm open to talk and to help.
Okay, Asier. So from our side, thank you very much. It was a really meaningful conversation that I wanted to have with you, and I hope the audience will enjoy it as much as I enjoyed talking with you. So thanks for coming. Whatever you need something, we are here.
Yeah, it's been a pleasure. So thanks for the invitation, and thanks for Twitter Health for having me on this podcast.
Okay, and just a friendly reminder to the audience that this podcast is brought to you by EIT Health Innovators Community. Join the network to participate in various webinars and workshops, win tickets to health summits across Europe, European Union, find jobs and opportunities in the healthcare sector, and much more. Visit community.eithealth.eu today. Thank you very much, Asier, and see you in the next chapter. Bye.
Bye.
Visit community.eithealth.eu to join our community and shape the healthcare landscape with us. For more such videos, subscribe to our channel.